Hi, this is Julie Bowen, and I'm going to talk about dry eye. So the first question is, describe my dry eye symptoms, and when did I realize that I had a problem with dry eye? I would say that it was over the course of the last year. I was on set in Georgia where they used a lot of atmosphere on the set. That's like a bunch of little particulates that fill the air to make the light look better. And during that period in Georgia, I started wearing contacts for the first time, and I could make it about 2 hours in that atmosphere before I had to pop them out and just go fuzzy for the rest of the day. My eyes were so itchy and dry, it was miserable. I was constantly using over-the-counter eye drops, but even still, my symptoms meant I couldn't use my contact lenses in the atmosphere and continue working. Why did I decide to try something different? The over-the-counter drops, they are fine for quickie relief, but they don't work when I need to keep my contacts in. They don't help me over the course of a day when I'm working in dry or artificial atmospheres. So with my dry eye, it just makes it uncomfortable to wear contacts at all. Plus, I kept having to step out after each take and drop them in, so I got Xiidra. Was I aware that inflammation could play a role in dry eye? No, I had no idea. When I went to my eye doctor, I told him I was getting irritated wearing contacts, and he said, you might actually have an underlying inflammation issue, and he prescribed Xiidra. He explained that Xiidra targets inflammation and over-the-counter drops don't. That's why they couldn't give me lasting relief, but the Xiidra really does. How does Xiidra fit into my everyday routine? It's very simple. Just use the drops once in the morning. I actually do it before I brush my teeth, and once at night before bed, and it just works. How would you tell someone that is suffering from dry eye about the relief you found from Xiidra? I would have to say, you need to be patient. This is not like over-the-counter drops, but once the Xiidra starts to work, it is much longer lasting and you don't experience dry eye on and off all day long. Lasting dry eye symptom relief helps me get my work done without being an itchy, red-eyed pain. I am super dependent on contacts and I cannot wear them when my eyes are inflamed.
Xiidra, lifitegrast ophthalmic solution, 5%, is a prescription eye drop used to treat the signs and symptoms of dry eye disease. Do not use Xiidra if you are allergic to any of its ingredients. Seek medical care immediately if you get any symptoms of an allergic reaction. The most common side effects of Xiidra include eye irritation, discomfort or blurred vision when the drops are applied to the eyes, and an unusual taste sensation. To help avoid eye injury or contamination of the solution, do not touch the container tip to your eye or any surface. If you wear contact lenses, remove them before using Xiidra and wait for at least 15 minutes before placing them back in your eyes. It is not known if Xiidra is safe and effective in children under 17 years of age. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For additional safety information, please find full prescribing information and patient information at Xiidra.com and discuss with your doctor.